So we can talk about that it's less severe, but to have 41 of our citizens die since Christmas from a disease, that doesn't seem very mild to me.
So we know that this variant so far with the data that we have is less severe, but also understand that because cases are increasing, hospitalizations are being overwhelmed. But just to recognize that the severity is less, and that data is available on the NCD-HHS website. So have you seen a reduction of severity and things like that in your hospital?
So we have fewer in the ICU, but we're being overwhelmed by the sheer volume of admissions. And I will say we've had 41 deaths since Christmas. So I guess for us, 41 deaths is a lot of deaths from one disease entity. So we can talk about that it's less severe, but to have 41 of our citizens die since Christmas from a disease, that doesn't seem very mild to me. You know, at my heart, I'm a clinician, and I don't like losing people from a disease, Mr. Upchurch. 41 of your citizens, of our neighbors have died since Christmas from this disease. One of them was a 43-year-old father with no previous known illnesses who came in with symptoms of a heart attack. And we took him to the cath lab. And we found out, because we couldn't find any blockages, we just found blood clots. And while he was on the table, we were trying to save him. We found out he was COVID positive with Omicron. And one of the things Omicron does is cause blood clots everywhere. And we couldn't save him. And our doctors had to go tell that mom. And there were little kids involved in that family. This is a terrible disease. So I understand that most people who get this are able to stay home. And most people don't have to go to ICU. But when it's bad, it's really bad. And my staff is traumatized from stories like this. And I know you guys' inboxes are full of letters of people lobbying you, but you're representing your constituency. I'm representing mine. And mine are my staff that are traumatized going into year 3 of these terrible cases, and we're seeing it again. And, you know, I'm not trying to argue with y'all or beat up on y'all are in a hard spot, but stuff is for real, and it's bad, and it's killing young people, and it seems so random to us. We can't predict for you guys how good or how bad it's going to be on any given day. And it's demoralizing our nurses and our doctors, and we are just asking for your help. That's